Hi, my name's Dr. Chris Snyder. I'm Chief Quality Officer at Tidal Health Peninsula Regional. This is my friend Bones. I've checked him for COVID. He's safe. Contact isolation won't get him. We're going to talk more about that in the upcoming events. It's showtime.
Well, here we are 7 months into the COVID-19 pandemic, and still, it seems like information changes every day. Numbers go up, numbers go down, everything's open, everything's closed. So where does Delmarva stand right now? Well, Dr. Chris Snyder is Tidal Health Peninsula Regional's Chief Quality Officer and their Physician of the Quarter. First of all, congratulations, Dr. Snyder.
Thank you.
So we have a lot of questions from viewers today, but first, what is the state of COVID-19 on Delmarva here right now?
So, based on the hospital, we're still having admissions. The good news is that we're not seeing death from COVID. In fact, we've had very few deaths from COVID in the last 4 to 5 months. And the ones that have passed were very sick to start with that got COVID. So that is good. So, we're not seeing nearly the illness or the acuity, the high level of illness. Most of the folks are coming in and it's acting more like the flu now. It is a fairly extensive illness. It lasts a couple weeks. But we're definitely seeing more community spread. We have probably average about 15 to 20 patients in the hospital. Very few in critical care. Majority of them are in our medical surge area. So a lot less acuity, a lot less illness associated with it. And we have a lot better handle on what we're doing with it also, which makes a huge difference.
Yeah, absolutely. I guess if there is a silver lining, that's it. Okay, so our first question, I've heard that COVID-19 is now a milder strain. Is that true? And you kind of alluded to that, didn't you?
Yeah, we're still studying this bug, and there's a lot of folks looking at it, trying to develop vaccines, et cetera. So as we're learning about it, again, the good news is I think the communities are getting more oriented to it and having a better response to it. It's interesting to see the peak in all the communities throughout the world in the first 3 months. Which was where we had our highest mortality rate. It almost went through and picked on the folks who didn't have an immune response. Unfortunately, it was a fairly aggressive and compensating disease. Since then, though, it's plateaued out, and people are, like I said, just getting kind of the average flu, and those folks who have problems are getting the sicker problems. Then I'm talking about asthma, COPD, diabetes, obesity, all those things that we've talked about for months.
All right. Another question here. I had symptoms and tested positive for COVID-19. I also have an underlying condition that affects my immune system. My fever is gone and most of my symptoms have diminished. However, I am still testing positive. Does this positive result mean I am still contagious?
The symptomatology really makes you more contagious, and that's, again, typical to most other viruses. When you have fever, when you're coughing a lot and doing all those things that COVID makes you do, those are the times where we think you have the highest spread capability of shedding the virus. If it's in your nasal cavity, it could be dead virus. The tests we're using are super sensitive in most cases. So if there's any virus in there, it will grab the DNA or the RNA, and it will actually show as a positive test despite being asymptomatic. So I don't know what the answer is to that yet. Stay tuned. We're learning.
Yeah, it has been a learning experience, I'm sure.
Oh, yeah.
All right. So another question, how soon would a positive test show after being exposed to COVID-19?
Well, it's anywhere from 72 hours to 10 days is kind of the area. That's why we quarantine for 2 weeks for folks who've been exposed. Now, you got to remember, I think a lot of people are missing the point here. If you have close contact with somebody, the CDC defines that as, and this is really important, close contact is less than 6 feet for more than 15 minutes unprotected without a mask. Those are, and the other person turns positive, that's when you need to get tested. If you're asymptomatic. Testing asymptomatic without close contact is really not recommended. So the asymptomatic testing that we're doing for those folks who don't have a close contact, I think is really, we have to stay away from that. And it's given us a lot of negatives. We're not finding positives in that population.
Okay, so then that kind of dovetails into the next question. Do you quarantine 14 days from the time you test, when the results come back, or when your symptoms start?
If you have a close contact with somebody, it's the last contact when that person was symptomatic. So you have a COVID patient who's symptomatic. They test positive. You've had close contact with them. Typically, it starts from that time forward. And our health department's doing a great job. They'll call you and check on your temps or text you every day too. So that contact tracing is what that quarantine period is for. And it is 14 days right now, and that's kind of the standard. If you're sick with COVID, it's only 10 days from the time you started your symptoms. And then you have to be symptom free for 24 hours before being released to your active activities again.
All right. Well, I tell you what, Dr. Snyder, we have plenty more questions, but we're going to take a quick break and come back to you next. We are back, and the doc is back in the house today virtually. Tidal Health Peninsula Regional's Chief Quality Officer, Dr. Chris Snyder, joins us, getting answers to your questions about COVID-19. And a lot of people have a lot of questions, so let's get right to it. Our next question is there really such thing as having COVID-19 but feeling absolutely fine, like nothing is wrong?
Yeah, there's a carrier state. Folks that don't get sick, and we see this in the young, they'll turn positive. We saw a lot of in the pregnancy population too, where they would be positive and totally asymptomatic. And again, those asymptomatic tests are available for folks to go get. So there is a false positive, I think, out there also in the literature. We're not sure what the numbers are. Again, these tests are based on your nasal swab and your exposures. And you know, again, much like flu, there's a lot of folks, I think, who get viruses and they're asymptomatic with them. That's good. We like those type of people. The ones we don't like, the ones that are critically ill and unfortunately require our services, what we're trying to avoid. But no symptoms is a good thing. And again, just trying to prevent yourself from infecting folks if you are positive is the key.
All right, our next question, this is an interesting one. I have several autoimmune issues and have stopped my biologic Remicade due to COVID and having to go to the hospital for the 3-hour IV. Am I more at risk to catch COVID? Am I more at risk for a cytokine storm reaction? If I test positive, would they admit me right away due to these factors, even if symptoms are mild? By the way, she is 57 years old, a female, slightly overweight.
Yeah, absolutely. You know, again, autoimmune disease and a lot of the folks on Remicade, steroids, et cetera, definitely put you at risk for any virus. So COVID is not unique for that. That's just any type of virus. Unfortunately, folks with autoimmune diseases get strange viruses. They tend to get shingles a lot, which is a herpes virus that causes the severe rash that a lot of people hear about. So, there's many examples of that. And so absolutely. Do you have to protect yourself? Hand hygiene, wearing a mask, you know, again, contact avoidance. And, you know, if somebody's sick, stay away from them. That contact timing and unprotected contact, I think, is really super important for somebody like you.
This question from a viewer, it's so irritating that so many doctors are saying different things. Why isn't everyone who is providing testing also doing the antibody test? Wouldn't it make more sense?
No, like I just said, the antibody test has really no science to it. We're discouraging that. The CDC doesn't recommend doing that at this point. The antibody testing is only being done in a research setting at this point. And we don't have all of the values of the antibody testing, so no, it doesn't make sense to antibody test.
Okay. All right. Well, I think the bottom line, though, is what you have been saying from the beginning. Wash those hands, wear those masks.
Yeah, again, that contact definition is important. Remember, 6 feet for more than 15 minutes unprotected. So that means you're sleeping with somebody, so your spouse. If they get sick, absolutely, you've had it. You know, that's where we do the quarantines at home. If you have children who are sick and you're having, you know, the contact. But again, if you're in the community and you're walking by people, you're more than likely not going to have enough exposure to get it unless you're unprotected. So wearing a mask in the community is really important. The whole mask thing is very difficult because it's somewhat subjective. There's really no good science around the mask unless you know somebody's truly sick. Then there is protective benefits. In the community, though, doesn't hurt. It's a reminder. I always use that getting in the elevator example. If there's 5 of you in the elevator and somebody doesn't have a mask on, either 4 people get out or 1 person gets out. So, and reminding ourselves that this is a very contagious disease and could cause you illness, especially if you're immunocompromised or elderly, is really important to protect each other and be responsible.
Yeah, absolutely. Dr. Chris Snyder with Tidal Health Peninsula Regional, thank you so much. And
Thank you.